originally from Boston. Been in Seattle for 38 years. I've got webs between my toes to prove it. I have been an alcoholic and an addict since I was 12 years old, plus the fact I'm bipolar. And I was looking for a place to go, and I was completely lost. I was lost in my addiction. I was lost in life. I had to look at my life and decide, was I going to continue to be a victim?
I was born with scoliosis when I was in a Chinese orphanage, and I didn't have the opportunity to have surgery when I was young. So I had operations for scoliosis when I was 16. It affected my lungs. Then I had surgery to help alleviate the lung. I knew I need to have doctor to stay healthy so I can take care of myself.
I've been a medical assistant for almost 10 years. I grew up in Eastern Washington. I come from a migrant farm worker family, and I'm proud to say that. As a little girl, I used to come and translate for my mom. I think that ended up sparking something in me. My mom was the one who showed me how to work hard and how to apply what was in my head to my heart and what was in my heart to my work. When times were tough, she did what she had to do to send me to school, to provide for me, and that showed me grit. I'm blessed she taught me that.
I grew up right outside of Seattle. I started to see what was really happening in a lot of communities, which is the reality that a lot of people don't have access to health insurance, to good care, to a regular doctor. That inspired me to want to change that. I want to be a conduit to people getting better access to care, getting healthier.
I came to Neighborcare about a year ago. For me, it was really about a return to community health. I grew up in a family where both of my parents were healthcare providers. I worked in the practice as the front desk, as an MA, kind of all the different roles, just sort of helping them out. I do feel like I understand what the challenges are for the different roles. It's a whole ecosystem that helps make all of it happen. I realized after talking to the people who work here, this was the place to be because of the dedication and commitment to the mission. There are those moments when you know that you're in a situation where you're able to provide something for someone where they couldn't get it anywhere else. There would be nowhere else. It reminds me that we have something here that's worth preserving and growing.
Neighborcare Health provides empathy and compassion, which is what I did not experience on the outside. I have a family doctor, I have a therapist, I have a nutritionist, and I have a social worker. But the one thing I will say about Neighborcare Health and all the people I deal with is they were never judgmental, and I never felt like I was being pushed away. I feel comfortable there.
I've known Paul for a few years now, and when I met him, he was a few years into sobriety. There was lots of things going on in his life, and so me and him really focused on managing mood, supporting that sobriety, exploring in an ongoing way what else he might need.
My healthcare team is working for me in a way that provides me with peace of mind and a sense of security.
I've met many times with his provider to talk about his progress. I've talked numerous times with his nutritionist to talk about how I can encourage the goals that they're working on. Paul's engagement has been the number one, I think, thing in his success, and us just backing him up has been what he needs.
I think emotional health, it's equally important as physical health. It is important to have your doctors and behavior person on the same team so they can provide care for you. Last year, I had dental experience. It's been heartwarming, and it helped me to really appreciate the dentist. And then my tooth fell off, and then I didn't know if I can get fixed right away. But I called Neighborcare, and then they answered right away. I was able to get an appointment the next day morning. It's now that I'm just coming to a place. I come to a place where people I knew, I trust, and it helped me to know what I need to do next.
I get excited for being able to help people. To me, that's the greatest satisfaction. A lot of us at Neighborcare have that one common goal, and when we focus on that, we, in a way, work together a way that a symphony would. we create a masterpiece, which is reaching that one common goal.
I get to work with people who are deeply rooted in the reason why we do our work, and that's a rare privilege.
There are people that have spent 20 years plus here at Neighborcare Health. It's a commitment to the patients of Neighborcare, to the people, and I'm profoundly humbled by the fact that they have chosen to be here with us.
I'm just so grateful to be alive. I've overcome addiction to alcohol. I've overcome addiction to opiates. My medications for my bipolar are working. I went from 350 pounds to 259 pounds. Life is good.
Each one of us comes with our own experiences, and we're able to learn from each other. I think I'm very fortunate to work with this team.
Those pieces of yourself that you bring are what makes such a difference for our patients and for the people you work with. So thank you.
There is not a day, there is not a decision made in Neighborcare Health that isn't a decision made by a team. Healthcare is a team sport, and Neighborcare does this better than any organization.